Hey, in this video, I'm going to talk about 8 ways that you can do to stop holes or tooth decay in your teeth in a second. So here's the secret of the 8% of adults who have never had a tooth decay or hole. Either they never caught this nasty bacteria or they have taken steps to remove it from their mouth. Without this bacteria, their teeth survive no matter how much sugar they eat or how poorly they brush their teeth. Teeth have natural deep grooves and are more likely to have holes because they will catch food particles, sugars, and bacteria more easily. Decay in this groove is also more likely to lead to tooth decay, cavities, or holes. So what are the 8 ways you can do to stop holes or tooth decay in your teeth? Number 1, brush with fluoride toothpaste twice a day, 2 minutes each time. It would be recommended that you brush your teeth at least 2 times a day. Toothpaste with fluoride has been responsible for a significant drop in tooth cavity or hole. Children develop the ability to spit at around the age of 3. For children under age 3, please use a smear layer of toothpaste for brushing. For children above 3 years old, you can use a pea-sized amount of toothpaste for brushing. Also, do take note to floss every night to remove bacteria that can cause tooth decay in between our teeth. Number 2, rinse your mouth with fluoride mouth rinse. Mouthwash with fluoride can help make your teeth more resistant to tooth decay, but children aged 6 years old or younger should not use it unless it is recommended by your dentist. Many children younger than 6 are more likely to swallow it than spit it out because their swallowing reflex aren't fully developed. Number 3, visit your dentist regularly. Even after trying your best to prevent tooth decay, sometimes the dentist find a little decay or 2. It may be tempting to put off tooth decay treatment when you're not feeling any pain, but that comes with a price. Tooth decay doesn't repair by itself, and it can quickly become a serious problem if we delay dental treatment. Number 4, consider dental sealant or preventive fillings. Sealants or preventive fillings are a thin coating painting on the chewing surface of teeth, usually the back teeth, the premolar or the molars. Molars are more important to prevent tooth decay. The liquid sealant quickly bonds into the deep depressions and grooves on the teeth, forming a protective shield over enamel of each tooth. Number 5, drink fluoridated tap water. Drinking water with fluoride, which is nature's cavity fighter, is one of the easiest and most beneficial things we can do to help prevent holes or tooth decay. Fluoride is a mineral that's in the right amount helps strengthen our teeth. You can generally get fluoride in your local tap water. Number 6, avoid frequent snacking and sipping of sugary food and drinks. Sugar by itself does not cause cavity or holes. Sugar in your mouth eat the sugar you consume and produce quantities of acid. It is actually the acid that causes holes in our teeth. It is definitely a good idea to limit frequency of snacking. You can always have snacks right after meals, then snacking throughout the day. Number 7, eat tooth-healthy food. Some suggested foods include fiber-rich fruits and vegetables. Food with fiber help keep your teeth and gums clean. Cheese, milk, plain yogurt, and other dairy products. Cheese is another saliva maker. Green and black teas, sugarless chewing gums, food with fluoride. These are all great examples of tooth-healthy food. Number 8, consider fluoride treatments. Dentists provide professional fluoride treatments in the form of a highly concentrated rinse, foam, gel, or varnish. The treatment can be applied with a swab, brush tray, or mouthwash. These are the 8 ways you can do to stop holes or tooth decay in your teeth. Question of the day. Which one of the above tips to stop holes or tooth decay are your favorite? My favorite is definitely number 1, on brushing using fluoride toothpaste. Type in your favorite tips in the section below. Thank you, everyone. I will see you again soon. In this video, I will share with you 5 ways to stop bleeding gums. Bleeding gums are actually a sign of gingivitis or inflammation of your gums. It's a common and mild form of gum disease, and it's caused by the buildup of plaque at your gum line. If you have gingivitis, your gum may be irritated, red, swollen, and they may also bleed when you brush your teeth. Occasional bleeding of the gums can be caused by brushing your teeth too hard or wearing a denture that doesn't fit properly. Okay, frequent gum bleeding is also an indication of more serious condition like periodontitis, which is actually an advanced form of gum disease. Okay, so today we're going to talk about 5 ways to stop bleeding gums. All right, and of course, the first way is brushing well. Okay, practice good oral hygiene. Brushing your bleeding gums can be a sign of poor dental health. Brush your teeth twice a day for a minimum of 2 minutes. Brushing with the soft bristles will also help stimulate your gum, help to prevent bleeding gums, and also strengthen the tissue that protect your teeth. The second thing we're looking at here is flossing well. Flossing every night, okay, it's important to make sure that we have less bleeding gums. So gums will most likely bleed more initially, but after a few days of consistent flossing, the bleeding will go down or eventually stop. Regular flossing improves your overall gums health and also reduce gum bleeding over time. Now, flossing well will actually get your gums better so that the gum bleeding will be much lesser. Number 3, of course, we're looking at stopping smoking. Smoking can lead to gum disease and many other diseases, especially for gum diseases, by affecting the attachment of the bone to the gum tissue of your teeth. This interference actually makes smoker more likely to have infection, gum infection like periodontal disease, which can also affect the gums and also affect wound healing. Yes, if you could stop smoking, great. If you can't, then reduce the frequency. Everyone has different pace, but good to always move one step at a time. If you can stop, great. If not, go in moderation. Cut down the frequency. If you are able to cut it down, that's one good step. Then slowly go down to bring it down to a stop if you could. That would be great. Okay, so stop smoking. Of course, the 4th thing is rinsing with a mouth rinse after you brush. Antibacterial mouthwash can both treat and also prevent bleeding gums. They actually kill bacteria and reduce inflammation, swollen, and bleeding gums. Mouthwash can also treat and also prevent gingivitis, which is a common cause of a bleeding gum. You can also use a salt solution, or just use some warm water, dilute lots of salt, and keep diluting it until it's saturated. Then you can use it to gargle. That's also another way if you don't have access to a mouthwash. Okay. Number 5, this is very important also. It's regular dental visit. It's good to visit your dentist twice a year, okay, for professional cleaning. Usually, I would say 6 monthly visit to your dentist is a good idea. However, your dental recalls or visits can actually range from a good 3 months to 1 year, depending on your oral care. If you have been cleaning very well, okay, your dentist might even suggest you to come back maybe once a year. If your dentist feel that there is a need to see you more regularly, they might actually want to see you maybe 3 monthly. Okay, when you're doing well, then we can see them every 6 monthly. So it really depends on individual. But as a guide, I would say 6 months is a good idea. Coming to that, your dentist will know if you have bleeding gums when you go for a regular dental visit, and they will teach you how to brush and also to floss properly. The other thing about professional cleaning is that it actually helps to remove stones, mineral deposits that is on the tooth. The deposits, okay, will actually make your cleaning and flossing difficult. This layer is actually rough, so more plaque or bacteria will stick to it, and because it's rough, it will attract more bacteria and plaque. Then the deposit will start getting thicker and thicker. Then over time, it will be more difficult to brush and floss. That's why even if you do brushing and flossing well, regular dental visit is still something for you to look into. All right, good. Yeah, so these are the 5 ways to stop bleeding gums. Hi everyone, in this video I will share with you what can you do about sensitive teeth. The most common symptoms is a sudden sharp flash of pain when teeth are exposed to air, cold, sweet, acidic or hot food. Okay, some people may experience tooth sensitivity from brushing and also flossing their teeth. Sensitivity teeth are typically the results of worn tooth enamel or exposed tooth roots. Sometimes, however, tooth discomfort is also caused by other factors such as tooth decay, okay, or a crack or chipped tooth, a worn-off or dislodged filling, or gum disease. What can you do about sensitive teeth? Sensitivity can be treated. The type of treatments will depend on what is causing the sensitivity. Okay, the following are some treatments, okay, that we can do at home and also in the professional setup in the dental clinic. Okay, number one, okay, we can use desensitizing toothpaste. Desensitizing toothpaste can help people whose teeth are sensitive to hot or cold. This toothpaste contains this ingredient such as strontium chloride or potassium nitrate. Okay, that helps block the transmission of pain signals from the surface of the tooth to the nerve inside. This is a little bit more technical. In short, it actually covers up the surface so that the teeth is not sensitive. Example of toothpaste for sensitive teeth, if you Google, you can find lots of brands. Okay, examples what we're looking at here, like Colgate Sensitive or Sensodyne. These are the two common brands. Number two, we're looking at using a soft-bristled toothbrush. To prevent sensitivity from recurring, brush your teeth twice a day with a soft-bristled toothbrush and fluoride toothpaste and floss daily. Okay, use gentle stroke rather than heavy scrubbing so that to avoid causing a tooth surface wear. Number three, avoid highly acidic food. Eating too much acidic food can damage the tooth enamel and weaken your gum line, which expose the inner layer of your teeth. When the inner layer of the teeth is exposed, the nerve center is exposed also, which also lead to more painful tooth sensitivity. Number four, use a fluoridated mouthwash. Okay, fluoridated mouthwash can help to lower down the bacterial count in the area, so that will help to reduce sensitivity. Number five, avoid teeth grinding. If you grind your teeth, ask your dentist about a mouth guard. Okay, you can see from the picture, from images, that over time through grinding, we can see the surface of the tooth actually worn off. When the surface of the tooth worn off, the enamel worn off, the dentin is exposed, that can actually cause sensitivity. So when it's an early phase, okay, if you find that your family member at night when they're sleeping, you hear some sound, or when they wake up in the morning, their jaw are tired, it might be a good idea to see your dentist and let them get to have a look to see whether there's need to get a mouth guard. Okay, good. A mouth guard will prevent further tooth wear. You can wear it at night. Every night you wear until the next day morning. If there's any wear, you wear the guard and you can protect your teeth. Number six, all right, avoid chewing ice cubes or eating hard or brittle food, as it may lead to cracking teeth. So also prevent gum disease, as it can lead to bone loss and gum recession. The roots actually exposed, that can actually lead to increased sensitivity. So at the dental clinic, your dentist may suggest a few treatment options. Okay, of course, one option is using desensitizing toothpaste, which we have covered earlier. Okay, option two, all right, also we're looking at fluoride gel, an in-office technique which strengthen tooth enamel and reduce the transmission of a sensation of hot and cold, or can be done. All right. Of course, we can also look at a filling or a crown. Okay, a crown, filling and a crown, this can be used to correct any flaw or decay that result in the sensitivity. Of course, surgical gum graft, if gum tissue has been lost from the root, this will protect the root and reduce sensitivity over time. Okay, so gum graft is a surgical procedure that the dentist can perform. Of course, there's also this root canal treatment. If sensitivity is severe and persistent and cannot be treated by other means, your dentist may recommend root canal treatment to eliminate this problem. So these are what you can do about sensitive teeth. In this video, okay, I will share with you 5 ways to stop teeth grinding. Why do people grind their teeth? Although teeth grinding can be caused by stress and anxiety, it is often during sleep, and it's more likely caused by an abnormal bite or missing or crooked teeth. It can also be caused by a sleep disorder such as sleep apnea. The signs and symptoms of bruxism may include teeth grinding or clenching, which may be loud enough to wake up your sleep partner. Increased tooth sensitivity or sensitivity. Tired or tight jaw muscles, or a locked jaw that won't open or close immediately. What are the 5 ways to stop teeth grinding? The first and most important way, of course, we're looking at wearing a mouth guard. An effective night guard will consistently prevent grinding from further harming your teeth. The night guard absorbs the stress and the forces and protect the enamel on the teeth from wearing down. Having this barrier between the teeth also relieves the tension in your jaw muscle from clenching too hard. All right, exercise. Exercise, whether you opt for a major sweat session or just something relaxed, working out helps to release stress, which is a common cause of bruxism. Okay, yes, yawning, massaging, relaxing shoulders, and neck exercise. This also will help to relieve the muscles. Okay, of course, don't chew anything besides food. Don't chew on pencil or anything that's not food. Avoid chewing gums. It's also allow your gum muscle to get more used to clenching and makes you more likely to grind your teeth. All right, learn to relax. Train yourself not to clench or grind your teeth. If you notice you are clenching or grinding during the day, position the tip of the tongue between your teeth. This practice train your jaw muscle to relax. All right. Of course, try massage and stretching exercise to relax the muscle. All right. Good. Okay. So exercise 1, you can place the tip of the tongue at the roof of the mouth. Open your mouth as wide and as comfortably can. Then hold for 5 to 10 seconds. Okay, that's exercise 1. So you can put the tongue at the tip, at the roof of the mouth, and open your mouth as wide as you can and hold for 5 to 10 seconds. Exercise 2, okay, slowly and steadily open your mouth as wide as it can comfortably open. Then with your tongue in a neutral position, hold for 5 to 10 seconds, then close your mouth. Okay, so open. Okay, then neutral position, then close your mouth. Next, you can open your tongue slightly and glide your lower jaw back and forth 5 to 10 times. All right, so do children grind their teeth? In some cases, children may grind because the top and bottom teeth aren't properly aligned. Others do it as a response to pain, such as teething. So kids might grind their teeth as a way to ease the pain. So you can just sometimes help them to rub their sore muscles. And usually kids overgrow this fairly common cause of grinding with age. Good. All right. Even my elder daughter also have this grinding issue. Initially, it scares the hell of me, and I was very concerned. But I guess that's just part and parcel of growing up. So any of you have kids that is grinding your teeth, you can inside the comment also. Let us know. Good. All right. So here are 5 ways to stop teeth grinding. I would say in the dental setting, the best way is still getting a mouth guard. In this video, we'll talk about the best way, the proper way to brush your teeth. If you're new here, my name is Dr. Tristan Peh, a Singapore dentist with 16 years of clinical experience. So today we're going to talk about brushing. Okay, so what we have here, this is a tooth model. how we brush our teeth. Okay, many people, we all learn many different techniques in school. Okay, in the past or from many dentists. Okay, some people would like to brush this way. Okay, the sawing technique. Sometimes they will do up and down. Okay, also one of the common ways is actually circular. Okay, one of the ways is circular. So what is the best way to actually brush your teeth? Okay, this is the bus technique. This is one of the best way to brush your teeth using the bus technique. This is what we dental students we all learn in school. Okay, so what you do is that you have a toothbrush. Always go with a soft toothbrush. Okay, with fine bristles. And what happens is that with the brush itself, okay, angle 45 degrees. Okay, angle the toothbrush 45 degree. Get the bristles. Okay, to squeeze into the pockets. Okay, get the bristles to squeeze into the pockets of the tooth. Okay, what we do now is also we jiggle. Okay, once we jiggle, then we flip upwards. Okay, so one more time. Okay, how we do this 45 degree. Okay, angle the toothbrush 45 degree. We want to squeeze the bristles, okay, of the toothbrush into the pockets. Okay, pockets or the gum pockets. So when we squeeze it 45 into the area, when we squeeze it, we jiggle. This will help to disturb all those bacterial track plug inside the spaces. Then we flick it out. This is how we can clean the area. All right. So to brush your teeth properly, okay, this is what you can do for this stretch here. Slowly move on. Okay. Always have a system when you brush your teeth. Always start from one end. Okay. Slowly move, jiggle up. Move, jiggle up, move, jiggle up, move, jiggle up, move, jiggle up. So one side, okay, then of course you can go with the top, okay, then once you've done the bottom, you can always do the same side also. This is the outside surface, okay, jiggle, move down, one round. Okay, once we're done with that, the next area that we can do is we can actually work on the inside surface, okay. For the inside surface, you can always same thing also, 45 degrees, squeeze the bristles into the area, jiggle, come out. 45 degree, jiggle, come out. 45 degree, jiggle, come out. 45 degree, jiggle, come out. But when it comes to the front area, then it's be a little bit more tougher to do this way. Usually I'll suggest going this way, jiggle, come out. Jiggle. The main thing is to squeeze the bristles into the gum spaces. Jiggle, come out. Jiggle, come out. Then over here you can do this. 45 degree, okay, jiggle, come out. So the same thing we do from the top also. For the top from one end, okay, to the other. So we got the two areas in done. The next stretch here, of course, is the biting surface. Okay, so to clean the biting surface, we're using the soft bristles. Okay, we scrub this area here. Okay, this is how we clean the area. Okay, we can clean the area. Clean this area here. When they brush too well, the other thing happens is when they saw their teeth. Do not saw your teeth. When you saw your teeth, enamel of our tooth can wear off. When it wear off, or the gums can actually recede, then we have this thing called teeth sensitivity. So we do not want to saw. Okay, we do not wear the area. Of course, if teeth sensitivity occur, what you can do at home, okay, a simple remedy, you can get Colgate Sensitive, you can get Sensodyne, apply a little bit of toothpaste on the finger, rub on the area that's sensitive, okay, keep it there for 5-10 minutes. That will help to relieve teeth sensitivity. Okay, of course, what we have described just now, we are talking about cleaning or brushing our teeth on the front surface, on the outside surface, on the top surface, and on the inside surface. Okay, one of the area that we are not able to clean is actually the in-between surface. This in-between surface. So the way to clean the in-between surface is actually using either a dental floss, okay, interdental brush. Of course, the next thing is a super floss. Is a super flosser, or is to clean underneath the bridge. Of course, we have a water flosser. These are the various ways that we can use to clean the spaces. So this is the way to brush your teeth properly. Okay.
In this video, we will share with you how to floss your teeth. So, what is the best way to floss your teeth? Most cavities and gum diseases begin in between the teeth, While brushing is important, the bristles in the toothbrush simply don't reach between the teeth. To keep your gums and teeth healthy, you must remove the food track or plug between your teeth at least once a day. That's why we recommend dental floss. In this video, we will share with you how to floss your teeth using dental floss. Coming up. I'm using the Oral-B Essential Floss to floss my teeth. Why 18 inches or 40 cm of dental floss around your index finger of your left hand? Pinch the floss between your thumb and index finger and leave about 1 inch or 2 cm in between to work with. Gently glide the floss down between the teeth
using a side-to-side motion. Pull the floss tightly in a C shape around the side of the tooth and slide it under the gum line. Clean the surface of the tooth by using a up and down motion, not side to side, until the surface is clean. When all the plug has been removed, you will hear the floss start to squeak. Then pull the floss around the next tooth and repeat the process. Wind the floss to fresh section and gradually work your way around your mouth, cleaning both sides of every tooth. Always start flossing from one end of the jaw and move slowly to the other end so as not to miss any teeth. Seesaw the floss gently into the space. Refer to earlier demonstration. Do not snap into the space unless you have years of flossing experiences and know how much force to exert without hurting the gums. We have completed flossing our top jaw. Now, let's continue flossing on the lower jaw. Start flossing from one end of the lower jaw and slowly work to the other end. Be patient with flossing. My first flossing took me 1 whole hour. You will get better in due time. We have completed our dental flossing.
If your gums are infected, they will bleed when you floss, and that's to be expected if you were to just beginning to floss. After a week or so of regular flossing, the bleeding should go away. Question of the day. How often do you floss? Daily? Once a week? Or never? So I hope you find the information valuable to share with you how to floss your teeth better. Keep smiling, and we will talk soon.
Oh, my wisdom tooth is hurting me. In this video, I will share with you how to manage your wisdom tooth pain before you see your dentist. People often decide to have their wisdom tooth removed as they can cause painful, aching gums. How can wisdom tooth pain be relieved at home before their removal at the dental clinic? Before we start, I would appreciate if you could please smash the like button, as that will help with the YouTube algorithm, and this video will be shown to more people on YouTube. There are several over-the-counter medical treatments and natural home remedies available. Number 1. Numbing gel. A numbing dental gel can help reduce filling in the gum and dull the pain. These gels are available over the counter or online and contain the active ingredient benzocaine. Most dental gel can be applied directly to the affected gum throughout the day. However, it's important for you to follow the instruction included in the product. Also, please exercise caution as it is possible to be allergic to benzocaine. Number 2. Ibuprofen. Ibuprofen is an over-the-counter pain relief medication that helps reduce inflammation. Taking the recommended dose on the packet may help relieve discomfort. It can also reduce inflammation of the gum associated with wisdom teeth development. Ibuprofen may be effective pain management until you can see a dentist for treatment. Number 3. Ice pack. Applying an ice pack to the jaw can help reduce inflammation, which in turn can relieve pain. Using ice can also have a numbing effect. You can try holding an ice pack with a towel around it against your jaw for up to 15 minutes. The ice pack can be applied off and on in 15 minutes break until the pain has subsided. Number 4. Brush and rinse with salt water or mouthwash solution. Soak your toothbrush in salt water or mouthwash solution before using them to gently brush the infected wisdom tooth area. This gentle brushing will help to get the solution into the infected area better. To make the salt water rinse, you can dissolve a few tablespoons of salt into a glass of freshly boiled water. After you are done brushing the infected side, you can rinse your mouth with the salt water or mouth rinse solution 2 to 3 times a day until the pain reduces or subsides. Removal of your wisdom tooth. In some cases, home remedy may not remove the pain of an impacted wisdom tooth. Your wisdom tooth can be removed in a dental clinic by your dentist. If you have just removed your wisdom tooth, you can check out my wisdom tooth removal aftercare video in the link above. In summary, while the remedy of this video can reduce pain by the wisdom tooth, they are only short-term solution. When wisdom teeth becomes impacted, your dentist would normally advise to have them removed to provide long-term relief. If you have any burning dental questions, you can leave them in the comment section below and I'll promise to get back to you soonest. You can also check out my other wisdom tooth videos above. Please subscribe to the channel if you have yet to done so and smash the like button. This is Dr. Tristan Peh and I look forward to seeing you in our next video. Thank you and I'll stay safe during this testing COVID-19 times. Goodbye.
Congratulations, you did it. It's done. Now, we're going to talk about how you can take care of your mouth after the wisdom tooth surgery. You're going to have some bleeding. You're going to have some gauze right here. Just bite hard on the gauze. Continue to hold, swallow saliva, and change the gauze every 30 minutes for 4 to 6 times. Then you cover the gauze. Then you can eat and drink as you would. So, there will be some swelling. What can we do about it? Swelling will usually be more on the first and peak around the 3rd and 4th day. After that, it will get lesser. So good to stay reclined. Keep your head above the heart. It's going to be a pillow behind your back. That will really help with the swelling. the next 2 or 3 days, swelling is going to get worse. You're going to feel, really? Yes, it's going to be swollen, painful. Take your medications as prescribed by your dentist. Now, if 7 days later or a week goes by, one side is red, hot, swollen, that's not so normal. So give us a ring and we'll let you know about it. So, what can we eat? Anything soft, nothing chewy, crunchy, mashed potato, mac and cheese, yogurt, pasta, noodles, rice, porridge, pancakes, scrambled eggs, puddings, ice cream. You can eat food, but it just have to be soft. Smoothie is okay, but no straw. Straw change the pressure in the mouth when we suck, and they can pull the clog out while it's trying to heal and cause dry socket. That is something we really want to avoid. Also activity. Activity can cause dry socket as well. You will like to keep chill for 2 to 3 days, no vigorous exercise, no heavy lifting. So what can we do now to care for our mouth? You're going to have little holes in your mouth. Food is going to get stuck up in there. So we would like you to rinse your mouth with water when you eat and snack. And also rinsing your mouth with water with mouthwash solution morning and night will help keep the area clean. As the week goes, the hole is going to get smaller and smaller. Food gets trapped might cause infection, so it's important to rinse the mouth well. You're going to have some sutures. 1 week later, we're going to see you to review the surgical site and remove the suture for you. In certain cases, we use resorbable suture. Don't worry, it will fall off by themselves after 1 or 2 weeks time. Yes, you might feel weird, funny with the suture in your mouth. It's fine. They will be removed in due time. Can you brush your teeth tonight? Absolutely yes. You can brush your teeth. Just brush them tonight and make sure to avoid the suture area. And that's about it. Any questions, give us a ring or email us. We'd love to answer all questions that you have. Have a great day. Have a good recovery. Do I need to remove my wisdom tooth? I had my lower wisdom tooth removed when I was in dental school. While the tooth was not hurting me, it was impacted and gave me lots of food trapping and trouble keeping them clean. However, not all wisdom teeth need to be removed. If they are coming out correctly with no crowding and you're able to brush and floss them well, then you can keep them. Wisdom teeth, however, can lead to problems when there are no spaces for them to surface or when they erupt in the wrong position. Your wisdom teeth may also be impacted, which means they are trapped in your jaw or under your gum. They can be very difficult to clean as food trap and often leads to the following problems. Number 1, the gums overlying the impacted wisdom tooth gets infected and become swollen. This is a painful condition called peritonitis. Number 2, they could cause decay on the adjacent second molar tooth. Number 3, the teeth in front could become crowded. Number 4, they could develop into cysts causing damage to the neighboring tooth. If removing wisdom teeth is necessary, it's easier in younger people because the tooth roots are not fully developed and the bone in which the teeth sits in is less dense. Extracting your wisdom teeth before any complications develop also allows for shorter recovery time and less discomfort after the surgery. If you're in doubt, you can always check with a local dentist to discuss the dental condition with you. If you have any burning dental questions, you can leave them in the comment sections below. This is Dr. Tristan Peh wishing everyone well and safe during these testing COVID-19 times. Take care. I'll see you again in the next video. Goodbye. In this video, I will share with you why wisdom tooth dry socket happens and what you can do to prevent and treat it. This is Dr. Tristan Peh, a Singapore dentist with 16 years of clinical experience. If you stay to the end of this video, you will discover 6 useful tips on prevention and treatment of wisdom tooth dry socket. This will help to reduce wisdom tooth dry socket pain after your wisdom tooth surgery. Occasionally, when the wisdom tooth is removed, dry socket may occur. Dry socket results from the loss of the blood clot from the extraction site. Signs of dry socket may include severe pain within a few days after wisdom tooth removed, empty space at removal site due to partial or total loss of the blood clot, visible bone within the empty socket, pain radiating from the socket to the eye, ear, temple or neck, bad breath or unpleasant taste. If you have dry socket, your dentist will recommend various treatments to promote healing and easing discomfort. Number 1. Treatment may include a medicated dressing in the socket to help reduce pain. Number 2. Anti-inflammatory medication like ibuprofen may be used. Number 3. Applying a cold press or ice pack. Number 4. Avoid cigarette smoking or any tobacco use since it can delay the healing process. Number 5. Also, for the first 24 hours, avoid drinking liquids through a straw as the negative pressure can dislodge the blood clot. Number 6. Brush twice daily and floss once a day to keep the mouth clean. Do try to avoid touching the empty socket. Your dentist wants what's best for your oral health. If you have any questions, don't hesitate to ask them. If you have any questions, you can leave them in the comment section below and I will get back to you soon. You can also check out my other wisdom tooth video. Please subscribe to my channel if you have yet to done so and smash the like button as that will help with the YouTube algorithm. This is Dr. Tristan Peh and I look forward to seeing you in our next video. Goodbye.
If you learned something useful today, please like and share. To stay updated to my future dental posting and videos, you can like my Facebook page and go to following and select See First. Number 2, you can go to YouTube, click on subscribe to my channel and turn on notification for future videos. Thank you and stay safe everyone.